Do all doctors accept Medicare? That's what we're going to talk about in today's video. So, welcome back to my channel. My name is Jamie from meetjamie.com, and I help people understand the Medicare program and find the coverage that fits their needs. And so, in today's quick video, what I thought I would talk about is maybe a common question that you've asked or someone you know has asked in regard to doctors and the Medicare program. So, if you're unfamiliar with how the Medicare program works, there's basically different parts to the Medicare program, and if you have questions about this, love to help you in any way that I can. So you can always reach out to me at my toll-free number or my website. I'll leave both of those in the description of this video. So there's basically traditional or original Medicare, which is your Part A hospital insurance and your Part B medical insurance. For most people, they're eligible for traditional Medicare when they turn 65. And then typically, people will also add a Part D, like drug plan, as well as a Medicare supplement plan. And so, because of a lot of people being new to Medicare and being used to maybe an employer plan or a private health insurance plan where there's a lot of conversation about where you can go to be seen as a Medicare beneficiary, that's what I want to talk about in today's video. So, in this article, it's entitled, How Many Physicians Have Opted Out of the Medicare Program? And so, there's a lot of debate happening right now around healthcare in the United States, and there's a lot of questions about providers accepting Medicare. And so, what I want to do is skip down to this little portion here that talks about physicians and other healthcare providers that register with traditional Medicare under three options. So, participating provider. Under this position, participating providers agree to accept assignment on all Medicare claims for all their Medicare patients, which means that they have signed a participation agreement with Medicare agreeing to accept Medicare's fee schedule amounts as payment in full for all Medicare covered services. And then you skip down to non-participating providers. Providers in this category accept Medicare patients, but can choose whether to take assignment, which is Medicare's approved amount, on a claim-by-claim basis. Unlike participating providers who are paid the full Medicare allowed payment amount, non-participating physicians who take assignment are limited to 95% of the Medicare approved amount. And in 2018, 99.6% of fee schedule claims by non-participating providers were paid on assignment. Physicians who choose not to accept assignment can charge beneficiaries more than the Medicare approved amount, but not exceeding 15% of the fee schedule allowed amount. So you may have heard before, especially if you're shopping Medicare supplement plans, about excess charges. This is particularly true in the Plan N and like Nancy, because unlike Plan G, excess charges are not covered under Plan N. So a lot of people who are weighing the options between Plan G and Plan N maybe have come across that terminology. That's what they're talking about. And then, of course, there's the third category, which is opt-out providers. Physicians and practitioners under this option have signed an affidavit to opt out of the Medicare program entirely. Instead, these providers enter into private contracts with their Medicare patients, allowing them to bill their Medicare patients any amount they determine is appropriate. Sorry if I'm looking over here and not at the camera down here. I have a much bigger screen here. Medicare patients seeing a provider who has opted out of Medicare program must sign this agreement and agree to be financially responsible for the entire cost of any services received. So that just gives you just kind of the three different categories. But this is what's most important. And again, just take note, this is as of 2020. So this is a little bit dated, but as of September 20th, or September 2020, excuse me, only 1%, whoops, only 1% of non-pediatric physicians have formally opted out of the Medicare program. So it's representing a very small percentage of the total number of active physicians. And so as you can see, the vast majority of physicians take Medicare. While the overall opt-out rate is 1%, opt-out rates are somewhat higher for certain specialties. And so then it shows you a little chart where you may see a higher percentage of physicians opting out. So as you can see right here, psychiatry and is the highest category at 7.2%, plastic and reconstructive surgery 3.6%, neurology 2.8%, and then it drops back down into the 1% again. And so just mentions here psychiatrists are disproportionately represented among the 1% of active physicians who have opted out of Medicare. And so what they're saying is among all the physicians opting out of Medicare in 2020, psychiatrists account for the largest share of opt-out providers. Then if you jump down here, it talks about in 47 states, less than 2% of active non-pediatric physicians in each state have opted out of Medicare, the highest being Alaska, Colorado, and Wyoming. And so it's just an interesting bit of research for those of you who are wondering how many doctors actually take Medicare. Again, this is a very high percentage. And just let me say one thing before I close out this video. It's important to remember that in this particular article, we're talking about the Medicare, original Medicare. This is not talking about Medicare Advantage or Medicare Part C, where you have an HMO or a PPO that is managing all of your Medicare. This is just talking about the Medicare program overall. And remember, if you choose to use traditional Medicare and a Medicare supplement, your Medicare supplement will be accepted anywhere that original Medicare is accepted. So it just follows original or traditional Medicare and supplements it. That's why it's called a supplement. And I can't emphasize this enough. Medicare supplemental insurance and Medicare Advantage are two different things. A lot of people use those two terms interchangeably. They're not the same. So you want to remember that when you're talking about a supplement, you're talking about covering the 20% gap in coverage from original Medicare. If you're talking about Medicare Advantage, that's completely different through a private health insurance company. Again, if you have any questions, feel free to reach out to me at my website or my phone number. I'll leave those in the description. If you like videos like this, please subscribe to my channel. Hit the bell notification so you know when I upload, and leave me a comment. Love to hear from you, your thoughts on this topic. Thanks for watching.